Welcome to an overview of Tier 2 of the West Virginia Expanded School Mental Health Framework. In this video, we will take a closer look at implementing Tier 2 early intervention programs, also called selective and indicated intervention. We will discuss what Tier 2 looks like, what it is all about, important components, and expected outcomes. The West Virginia Expanded School Mental Health mini-webinar series covers 12 topics that will help schools and their partners gain a full understanding of the expanded school mental health model and prepare for implementation. This video is the third in that series. I'm Garrett Kiefer, HHR Specialist Senior with the Bureau for Behavioral Health in the Office of Children, Youth, and Families of the West Virginia Department of Human Services. This video series is presented by Marshall University School Health Technical Assistance Center, Division of Community Health in the School of Medicine, with funding from the West Virginia Department of Human Services, Bureau for Behavioral Health. Our learning objectives are 1. Increase understanding of Tier 2 of the West Virginia Expanded School Mental Health Framework, and 2. To provide relevant resources. Let's do a quick review of the 3 tiers of ESMH. Tier 1 serves all students and includes universal prevention and promotion of mental wellness. Tier 2 provides early intervention via selective and indicated supports for at-risk students who are identified with behavioral, academic, attendance, or emotional needs. Tier 3 is the most intensive level of intervention. Services may include clinical mental health therapy and/or intensive interventions that are provided by qualified mental health professionals in a school setting during the school day. This video will focus on Tier 2, which serves selected at-risk students who are identified with behavioral, academic, attendance, and social or emotional needs. Tier 2 is all about supporting students who have demonstrated needs in areas such as communication, social skills, substance use, anger, stress, and mild mood concerns. Schools identify these students using disciplinary data, screening, attendance reports, grades, and referrals. The purpose of Tier 2 services is to prevent the exacerbation of symptoms and behaviors that put students at risk by developing coping strategies, skill building, increasing feelings of belonging, and reducing out-of-school discipline time. Through Tier 2, schools can monitor students closely and collaborate to provide support when needed. What does Tier 2 look like in schools? Tier 2 is delivered by facilitators trained in the use of specific evidence-based programs. Facilitators may be school counselors, prevention professionals, mental health providers, or other trained representatives. Most Tier 2 programs are structured for delivery in small groups, but some may be provided to individual students. Programs generally include a specified number of regularly scheduled sessions that take place outside the classroom. Schools may schedule these sessions during in-school suspension, detention, lunch bunches, after or before school programs, or study hall. The ESMH framework requires the use of evidence-based programs, or EBPs for short. These Tier 2 EBPs are widely used in West Virginia. For a comprehensive list of approved programs, refer to the WV website. Tier 2 programs are most successful when teams include these important pieces of implementation. The ESMH leadership team should use school data to determine skill areas most needed by the students and select programs that address those topics. Sources of data may include discipline, grades, and attendance from the WV system, student screening, Zoom WV, learning environment surveys, SAT referrals, and 504 or IEP plans. Integrate Tier 2 sessions into the school environment by planning ahead to incorporate Tier 2 into the school schedule and to develop protocols for responding to specific student needs and disciplinary issues. Lunch groups, in-school suspension, study hall, and after-school programs are good examples of planned integration of Tier 2 into the natural school environment. Because Tier 2 programs are not billable services, implementation requires the most collaboration. However, it is worth the effort because Tier 2 can have huge positive impact when implemented with fidelity. Schools need an informal process for identifying and referring students to Tier 3's more intensive treatment services when the Tier 2 services are not producing the desired results. Schools should remember to include staff training and support to ensure champions aren't the sole facilitators of selected programs. Multiple trained staff members add stability to implementation. Finally, it is vital that the administrators fully commit to the ESMH framework and that leadership teams involve staff in decision-making to ensure staff buy-in. What outcomes can we expect from good implementation of Tier 2 selective early intervention? Students receive support early in the school environment. Schools with good Tier 2 programming experience fewer critical incidents because students learn skills needed to manage difficult emotions and problems. Early identification of the need for clinical services means students get the help they need sooner, reducing the likelihood that hospitalization will be necessary. The West Virginia ESMH website has many resources and tools for your convenience, including detailed information about our framework, a 10-step implementation guide, approved evidence-based programs per tier for grantees, an extensive resources page, and a news and events page where you can see highlights from ESMH and AWARE grant sites, as well as upcoming trainings. We encourage you to check out all of our videos on the Marshall University School Health Technical Assistance Center's YouTube channel. Thanks for joining us to learn about Tier 2 in the West Virginia Expanded School Mental Health Framework. Check out our other videos in this series where we explore different components of the West Virginia ESMH framework.